Good morning, everyone, and welcome to UroNurse News. I'm Vic Senese, and don't forget to like and subscribe. Today, I'm exploring a topic that is reshaping how scientists think about women's health: menstrual blood. Once considered routine biologic waste, it's now being studied as something far more powerful with a potential diagnostic window into the body. Researchers are increasingly describing menstrual blood as a very unique biological specimen. Why? Because it's not just blood. It contains a complex mixture of blood cells, hormones, immune markers, endometrial tissue, and cellular material from reproductive organs. In other words, it may provide a more complete biological snapshot of uterine and reproductive health than traditional blood samples. Across new studies and biotech startups, researchers are identifying potential links between menstrual blood and a wide range of conditions, including endometriosis, cervical and endometrial cancers, diabetes, thyroid disorders, vitamin deficiencies, and even environmental toxin exposures. Some companies are already analyzing thousands of menstrual samples to identify disease biomarkers, signals in the blood that may point to early disease before symptoms become severe. For many patients, this research is deeply personal. Women with conditions like endometriosis often report years of severe menstrual pain, nausea and vomiting, missed school or work, and delayed diagnosis. In some cases, diagnosis can take 5 to 12 years. Researchers believe menstrual blood testing could shorten that timeline dramatically, potentially offering a non-invasive alternative to surgical diagnosis. Here's what makes menstrual blood scientifically unique. It may contain material not found in standard blood tests, including cells shed from the uterine lining, reproductive tract biomarkers, immune system activity specific to the uterus. Scientists say this creates what is essentially a natural biopsy of the reproductive system. New technologies are being developed to use menstrual blood for at-home disease screening, fertility and hormone monitoring, infection detection, metabolic health tracking, including blood sugar. Some tools are already in clinical trials, while others have received early regulatory approval for specific testing applications. Despite the progress, researchers emphasize one major challenge. Menstrual blood has been historically understudied due to stigma, lack of funding, and long-standing bias in medical research. It has not received the same scientific attention as other biologic samples. That's now changing. Institutes like MIT and multiple biotech startups are investing heavily in menstrual science, calling it a part of a broader menstrual revolution in medicine. As research advances, scientists hope menstrual blood could one day become a routine diagnostic tool, a window into early disease detection, and a key to closing long-standing gaps in women's health. What was once overlooked may soon become one of the most valuable biological sources in medicine. Hey, tomorrow on UroNurse, you don't want to miss this one. Varicoceles are more common than you think, and they could be silently impacting fertility, testosterone levels, and chronic scrotal pain. In this episode, I'm going to break down what a varicocele really is, when it becomes a problem, treatment options that actually work, and how intervention can improve testosterone levels, sperm quality, and pain. So whether you're managing patients or dealing with symptoms yourself, you don't want to miss this episode. So tune in at UroNurse.com tomorrow to learn more at 9 a.m. at UroNurse.com. See everybody next week for more of UroNurse News.
UroNurse News every weekday at 9 a.m. Central Time.
Breaking out, we bring it to you. Every side, every